On Friday, October 2nd, there'll be thousands of dollars to be won. A lotto jackpot of $111,000. A new home, car, or that college education.
Lotto, you have to be in it to win it.
Next lotto jackpot, $111,000.
More jackpot money, more reasons to play this game. More money for way, Super 6 a bigger jackpot game.
This Friday, October 11th, the Super 6 jackpot is $200,000. Super 6, more jackpot money.
More jackpot money, more reasons to play this game. More money for way, Super 6 a bigger jackpot game.
This evening on the VC3 News Update, Prime Minister Dr. The Honorable Ralph Gonsalves highlights that the decline of the GDP of St. Vincent and the Grenadines was the lowest in the currency union. Local farmers assured that efforts are being made to address the issue of predial larceny by the Ministry of Agriculture, Industry and Labour. And the Book of Vincentian Patriotic and School Songs expected to play an important role in bridging the generational gap according to the National Cultural Foundation.
And in sports, last weekend hosted 4 matches as the Hyrule Northeast Football League Village competition went full throttle at the Chile playing field. Also, Year 2 Arts, Sciences and General Studies thumped Year 2 Technical and Vocational 6-0 in the interfaculty football competition. Also, Volcanoes and newcomers Cali Ballers played to a 1-all draw yesterday at the Stubbs playing field. Regionally, Cricket West Indies and New Zealand Cricket yesterday announced the proposed schedule for the bilateral series to play 3 T20 internationals and 2 tests from November 27th to December 15th.
Join us at 7 p.m. for these stories and more on the VC3 News Updates.
And welcome to our viewers. I am Tedra Kirby. Welcome to the Round Table Talk for a special edition today as we commemorate Mental Health Awareness. On my left, I have with me Miss Ellica Matthews, Counsellor at the Mental Health Rehabilitation Center in St. Vincent and the Grenadines. And on my right, I have Miss Roselle Solomon, Social Worker within the Ministry of Health, Wellness and the Environment. Welcome to the Round Table, ladies.
Thank you.
And today we're talking mental health. What is the purpose of Mental Health Day?
Okay, so Mental Health Day is here to commemorate and, bring light to issues of mental health across the world. What we want to do is start the conversation, but not just start it, but to keep it going as we go along. Mental Health Awareness Day is celebrated on the 10th of October 2020. And it is celebrated every year. So every year it's celebrated on the 10th, and there are different themes every year because, as we know, mental health covers a vast amount of things. So every year they try to draw light to a specific issue as it relates to mental health.
Now we hear the term mental health, but I feel as though sometimes some people are still not exactly aware of what is meant by mental health. So Ms. Solomon, can you share some light on what is meant by the term mental health?
Well, usually, colloquially, a lot of persons think when they hear mental health, they think about mental illness. But mental health is all about how you think, how you feel, how you act, that overall feeling of how you think, how you feel, how you act, and how you cope with any stressful situation. So Mental Health Day and what we're observing is to just highlight those issues. There are some persons who cope negatively, and we are here to address those and to help them.
Wonderful. Now, as you said a while ago, Miss Matthews, the theme changes every year. So for 2020, in a year that has been marked by so many things, and we'll get to COVID in a minute, what is the theme for Mental Health Awareness Day 2020?
So for Mental Health Awareness Day 2020, the theme is Mental Health for All, Greater Investment, Greater Access. And basically this theme is here to highlight 2020 has been a very difficult year. So it's here to highlight that persons need to start accessing the service. So greater investment, we need to come in, not just one person, but as a community, we need to shed light on mental health and mental health related issues. As a community, we need to start addressing mental health. We have to start normalizing mental health as a service. When we think of health, it encompasses. We want you to think health, physical health, mental health. So accessing it as a community can be you just being encouraging. And then access for the individual. Everybody should be able to access the mental health service. And we just want to let persons know where they can, when they can, when do they feel they should access this service, different things like that.
So speaking of access, we're in a society where, as you say, mental health is often stigmatized. What are some of the ways that people can reach out and access mental health support? Ms. Solomon?
For me, when I hear the word access, is not just about for persons with any mental health issues. It's creating programs that's just there to help the well-being of any individual. So we're looking at community groups, we're looking at healthcare facilities, we're looking at any approach that would be able to help somebody, or preventative, or recovery, rehabilitation, treatment, care and support. So from birth to, God forbid, death, through your lifespan, there should be programs to help your well-being, to help you feel better, to help you just live a quality life.
Oftentimes in St. Vincent and the Grenadines, we wait until it gets unbearable. We know within our society we battle with things such as suicide and other really risky measures to basically, what's the word I would look for? To come to life before we seek that type of attention. At what point should I or anyone watching our viewers out there look to access or speak to someone about mental health issues that we may be experiencing?
So persons should access this service when they feel it necessary for them. As we know, every individual is going to be different. I might be able to tolerate something on a greater level than any individual. Where we start at mental health, we ask persons, has it been interfering with your day-to-day functioning? That is one of the things that we look at when it comes to mental health and accessing services. For all persons, we encourage them, don't wait until it gets too serious. If you feel like you have an issue that you're struggling, you've been through a traumatic event, and you feel you need that added assistance, reach out to mental health. But when we tell persons, okay, this is the point when you need to do it, when it starts to interfere with your day-to-day functioning. So, okay, every day, you're supposed to get up, take a shower, breakfast, get the kids ready for school, get to work. And then there are days when you just don't feel like doing it. You don't want to shower, you don't want to get your children ready for school, you don't want to go to work. These are the things when we say it interferes with your day-to-day functioning, because everybody has baseline behavior. These are things that they do every day that they're accustomed to doing. When persons start to operate outside of that baseline behavior, being they're operating below, they're not functioning, or above where they're erratic, these are things that persons have to start looking for to get help, to accessing services. These are the small things that persons can look out for.
We, within St. Vincent and the Grenadines as well, we sometimes we're very fearful to reach out. We always worry about what would he or she say if they know that I'm seeking mental health support. To the people who may be a bit doubtful about the aspect of confidentiality within seeking your services, what would you say to those people?
It's understandable. We have all gone through some phase of our life where there has been mistrust. And I would say to persons, step forward still, because your mental health, your mental well-being is key. But on the flip side, we have to make it easier for persons to step forward. So it's not just mental health services. For instance, in the schools should have those safety nets where they're able to say to someone, I don't feel well, this is happening to me. So mental health and mental health programs are key. They're injected everywhere, in education, they're in agriculture, they're in the police. So wherever it is that someone is thriving, where they're growing, where they're accessing their daily activities, or where they're doing their daily activities, these initiatives should be there. So wherever you are, your program should highlight that and highlight those issues where people can access the care. So go ahead, ring up mental health center, ring up a counselor, a pastor, a friend, because I may not be someone who may be able to help, but I may know someone who's, because we're a small society.
Correct. It's a holistic service. So it's not just, if I need help, I have to go straight to mental health. You can stop and say, okay, I am comfortable starting with the youth leader or the pastor in my church. I'm comfortable speaking to a teacher. It doesn't have to be, I have to come directly to mental health, because mental health issues can be caused by different things. And if you alleviate that stressor in the person's life, that can help them to come to a place of wellness. And counselors, social workers, we aren't the only people that can be helpful in this industry.
Now, you guys have said two important things that I want to address.
Sure.
So, Ms. Solomon, you mentioned school. So I'm going to widen it a bit to also include the workplace environment, especially in businesses that are profit-oriented. How can employers, institutions, ensure that their employees are in good mental health?
Wow, this brings me back to October 10th, around the year, so 2017,
2018. Yeah.
Because the theme of that year was mental health in the workplace. So it highlighted, one, the environment can be stressful, and it can impact on someone's mental health and their performance and the workplace's productivity. In addition, there are persons who may have mental health issues, diagnosed mental health issues, and have to perform in the workplace. So it's having the employer or the employees understand that mental health and mental illnesses, they need to be addressed within the workplace. So one, what we did was that we had a range of workshops with different workplaces, private sector, public sector.
Wonderful.
We had a symposium that brought different professionals out, so we're able to pass on that information. And the thing is that, yes, I understand profitability and profit, but in order to get to profit, your employees have to work optimally. Therefore, you have to take care of not just their physical health, but their mental health. And to be honest, in the research that I've done, the workplaces or the industries that have a focus on well-being, they have a high productivity, a high profitability, because they saw the need to take care of their employees, and their employees saw that, and therefore they worked even better. There are places where mothers were concerned about where they were going to place their children for daycare, and they opened up their own daycare within the environment, so you relieve that stress from that particular parent. So it's about understanding your employees, making sure you hear them, you listen to them, and you get to that place where you're able to come to an agreement as to how we're going to work together. How I'm going to work for you, my employees, and the environment that I create for you, and in return, I'm understanding that they care about me. They want me to work. They want me to feel good. And therefore, we're going to work to the best of our ability.
Because somebody that is mentally healthy is the most productive person you can have on your force.
I definitely agree. True. Within St. Vincent and the Grenadines, though, what are perhaps 2 or 3 suggestions for businesses here, knowing our environment, that can improve workplace mental health?
Wow. Some of the suggestions were higher pay.
Okay. Yeah, so people start with general stuff like we need to make more money. But to be honest, we need to start with listening to your employees. Like, I think sometimes employers take for granted the opinions and the voice, especially when it comes to things that are stressing them out. It's sometimes, okay, that's your problem. You sort that out at home. And that has nothing to do with the work environment. Just come in and be productive. But the thing is, you have to start listening to persons. You have to start having that conversation in how can we make this a bit more comfortable so you can be a more productive employee for me. So one, start by having that conversation. What can we do? Two, you can give them access. Let them know, should you be experiencing an issue, this is where we think you should go. And two, being flexible, not taking advantage of, but being flexible in situations that absolutely cannot be controlled or helped.
That's really sound advice, and I really hope a lot of our employers are listening right now. We are at the round table. This is Round Table Talk with Tedra Kirby, Ellica Matthews, and of course Miss Roselle Solomon. We'll be right back.
This evening on the VC3 News Update, Prime Minister Dr. the Honorable Ralph Gonsalves highlights that the decline of the GDP of St. Vincent and the Grenadines was the lowest in the currency union. Local farmers assured that efforts are being made to address the issue of predial larceny by the Ministry of Agriculture, Industry and Labour. And the Book of Vincentian Patriotic and School Songs expected to play an important role in bridging the generational gap, according to the National Cultural Foundation.
And in sports, last weekend hosted 4 matches as the Hyrule Northeast Football League Village competition went full throttle at the Chili playing field. Also, Year 2 Arts, Sciences and General Studies thumped Year 2 Technical and Vocational 6-0 in the Interfaculty Football competition. Also, Volcanoes and newcomers Cali Ballers played to a 1-1 draw yesterday at the Stubbs playing field. Regionally, Cricket West Indies and New Zealand Cricket yesterday announced the proposed schedule for the bilateral series to play 3 T20 internationals and 2 tests from November 27th to December 15th.
Join us at 7 p.m. for these stories and more on the VC3 News Updates.
More jackpot money, more reasons to play this game. More money for way, Super 6 a bigger jackpot game.
This Friday, October 11th, the Super 6 jackpot is $200,000. Super 6, more jackpot money.
Hey! More jackpot money, more reasons to play this game. More money for way, Super 6 a bigger jackpot game.
And welcome back, ladies and gentlemen, all of our viewers. This is Roundtable Talk. We're speaking mental health today. I am Tedra Kirby with Miss Matthews from the Mental Health Rehabilitation Center and Miss Solomon from the Ministry of Health, Wellness and Environment. Mental Health Awareness Day is coming up, ladies and gentlemen, and both women are here to shed some light on the activities coming up, and we're speaking all things mental health, which is really an important component of our everyday lives and being able to manage our mental health. So if you're just joining us, welcome to Roundtable Talk. So Ms. Matthews, in the earlier segment you mentioned there are certain telltale signs, and you mentioned quite a few. Just for the viewers who are now tuning in, would you like to just
Run through the
over.
signs.
Yes.
Okay. Yes, I can do that. So when we're thinking warning signs for a person that may be suffering from a mental illness, there are things that we have to look out for. Any individual can look out for. And when we give you these warning signs, it's things to look out for and not to diagnose other persons with, because we oftentimes have issues where we go out, we run programs, we say, okay, this is what you can look out for in an individual, and then we come back and it's like, I think such and such is depressed. So these are signs to look out for that can signify, okay, a person needs that help, they need that assistance. So we have eating less or eating too much. We have persons might start pulling away from individuals that they're accustomed being around. So you start pulling away from your loved ones. You may have somebody that is very social, and then all of a sudden you find they don't want to leave the house, they don't want to do anything, they don't want to interact with others. Persons who have low energy, so their energy has decreased, they've become very lethargic, they don't want to do anything, and for everything that they do, they're really slow. Feeling numb or like nothing matters. So all of a sudden your life has no purpose, it has no feeling for you. It's just you wake up every day and it's just a monotonous process that is just going and going. Having unexplained aches and pains. So you would have gone to the doctor, and no matter what you do or what conversation you have, what tests you run, there is just an unexplainable ache, and we usually find it in places such as the shoulders, neck, lower back. It's like a tension that you just can't account for. Feeling helpless and hopeless. So persons now start to feel, okay, I have no purpose, why am I here? What am I here to do? What am I here to accomplish? And they start questioning themselves, and everything that they do now comes with some level of doubt. So it's like, why am I doing this? Things like that. Drinking, smoking, drug use, that's a major issue. Where persons' drug use, it increases. So you may find somebody that never used to drink and smoke, they've started to do it, or somebody who does it, they've increased doing it, and it has become very, very reckless. Feeling unusually confused or guilty, forgetful. People starting fights with family members, and it's fights that you cannot explain. So persons are just getting into unnecessary arguments with persons, unnecessary fights within the home. Experiencing mood swings. So we have mood disorders, and when we're looking at that, we really look at persons' moods and how a person can just switch from 0 to 100. So they've been really sad and then they just get really happy, or they've been really happy and then they get really upset. So just switching off their moods from one to the next. Having persistent thoughts and memories of the same thing. So let's say somebody would have experienced a traumatic event. For example, they were raped, or a family member that they really loved died. And then they find that they're just replaying in their mind 24/7, and they can't find time to do anything else, or anything else that they try to do, they're unable to focus. So it might be at work, and you're at work, and instead of typing or doing what you're supposed to be doing, the only thing that comes to mind is that memory, and that in turn can make persons overly emotional. A very important one, hearing voices. If you begin to hear voices, see things that other people cannot see, if you start to have beliefs that we know aren't true, like for example, somebody comes down and they tell you, okay, I'm the Prime Minister, or I'm the Queen, and I am not going to answer to you unless you address me as such. Simple things like these are things that we can look out for. Thinking about harming themselves or others, and a major one that we encourage persons, if you are thinking about this, if you are experiencing this, we ask persons to get help if you're having suicidal ideation. So if you are thinking about hurting yourself, if you are thinking about killing yourself, if you have attempted and you have failed, we are asking you that you get assistance right away. That is not something we want persons to play with. It's not something we want persons to adjust to, because people think that if we talk about suicide or if we encourage persons to get the necessary help, it's going to further drive them to want to commit suicide. But it's actually different. Persons who talk about committing suicide are usually the persons that want help. They want assistance. They want somebody to reach out on their behalf. So I understand wanting to keep a secret for a friend, wanting to be confidential, because a lot of people struggle with that. But when it comes to suicide, it is so important that you get the person that necessary help.
All right. That's some very, very extremely valuable information. Miss Solomon, do you think she has it covered, or you'd like to add
She has it covered.
anything else?
But what we'd like to say is that when you're observing your friend or your family member, it's good to look at the time frame. So it's not just an isolated event where I might walk in here and say, I'm so tired. If you're observing that person over a period of time and you're realizing that they are not functioning how they used to, they're withdrawing from friends and family, they're not coming into Victoria Park to play football as they're accustomed to, then it's something where that red flag would pop up. You say, that's not my friend, something is up. And not maybe just one thing, but a couple of different things over a period of time, then definitely you get your friend some help or your family member some help.
So we've heard it. There are so many symptoms and so many signs to look out for. I want to localize this just a bit. We've had instances, or we've heard of instances where people may be exhibiting these symptoms, and then we try to come up with a local remedy for it, such as you may tell them go and bathe between the fresh and the salt, and a lot of these local things. To the people who encourage that type of response, what would you say to them if they were listening right now or watching right now?
Okay, so I am a trial and error type person. I am not going to come in and specifically say that is not going to work. My approach is if you've tried it and it's not working, then you have to think about getting additional help, because there are persons that have come to us and they've stated, okay, they just need prayer. They just need to go to church. They just need some holy water and they will be okay. And people process things differently, and we don't want to take away from persons and what they know. So what I do, we encourage, we say our opinions, we give our professional opinions in that this is what we think it is. If you seem otherwise and you want to try otherwise, we cannot physically stop you. But what we're asking, if you go out and that does not work, please bring them back to mental health. Let us try something else. Everything is going to be a trial and error. If your method doesn't work, we have a method as well.
Speaking of not being able to stop you, in our communities, in our families, in our homes, if again we realize someone is exhibiting these symptoms, and can they be forcibly admitted, let's say, put on suicide watch or any other preventative measures? Can that be done at the Mental Health Rehabilitation Center or in any other department?
All right, so let's dissect it. Let's take suicide out. Once someone has mentioned that they want to self-harm or they want to take their life, it's recommended you let the police know. You let somebody know, you take them to the hospital, the nearest clinic, because definitely we need to make sure we keep an eye on that person. We bring in our counselors, our psychologists, our doctors to assess what is driving those, what are driving those thoughts. So let's take suicide out. Anybody who is talking about suicide, take them to the hospital, call the police, get them that help. With other persons who are experiencing other symptoms, it's almost the same process. Not straight to mental health center, because someone who's exhibiting whatever signs or symptoms, it may not necessarily be a mental health issue for admission. It may be a spike of a fever. It could be something else, high blood pressure, it could be diabetes. So that medical check first to make sure that everything is medically okay. If not, then the doctor would recommend admission.
Because when it comes to mental health and mental illnesses, we have to be mindful of checking health as well, because what doctors have seen, sometimes certain things can mimic a mental illness. So for example, if your hypertension is low or your diabetes is too high and a person becomes psychotic or one of these things. So we have to make sure, rule out that medical issues aren't playing a part in the symptoms that you are experiencing. So it's not just they're behaving this way, so let's take them straight to mental health. It's a process of they're assessed by the hospital. If medical issues are ruled out, then persons will be referred to mental health after that for treatment.
So if they're exhibiting symptoms, you take them to the nearest clinic and they're assessed, and then if need be, they're taken to the mental health.
Yes.
Okay, that sounds like a proper step-by-step process as we discuss mental health. Mental Health Awareness Day is coming up, ladies and gentlemen, October 10th.
Yes, it is.
And we're going to have an entire week of activities and events right here in St. Vincent and the Grenadines, of course, spearheaded by the ladies and their lovely team within the Ministry of Health, Wellness, and the Environment. Lots to talk about. Stay right here on the round table. But just before we go, though, we mentioned clinics and all of that. If someone does decide to contact you directly, what number should they call? I know you said the police, so is it 999?
Well, you can contact your individual, your respective
your nearest local police station,
or your clinics, or your private doctor. But mental health, we have two numbers. It's 4586185. I'm proud of myself for remembering that one. It's new. And 4584240. So 4586185 and 4584240.
So you heard it. Those are the numbers. In the event you're possibly unable to get in touch with your local police station or your local clinic, you can reach out via those numbers. But of course, try your local clinic or police station before you do?
Yes.
Before you do, because there are steps in which you can follow as we look to talk about more about mental health. It's been such a taboo subject. But don't go anywhere. We still have lots to talk at the round table talk.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
This Friday, October 11th, the Super 6 jackpot is $200,000. Super 6, more jackpot money.
Hey! More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
On Friday, October 2nd, there'll be thousands of dollars to be won. A lotto jackpot of $111,000. A new home, car, or that college education.
Lotto, you have to be in it to win it.
Next lotto jackpot, $111,000.
Crazy, 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 oh.
Crazy, crazy.
welcome back to Roundtable Talk right here on VC3 channel 114 on, of course, local cable TV. So with me, we're still talking mental health with Miss Matthews and Miss Solomon. Miss Matthews is a counselor at the Mental Health Rehabilitation Center, and Miss Solomon is a social worker within the Ministry of Health, Wellness, and the Environment. We have to address the big monster, the big global monster when it comes to mental health right now, COVID-19. Right, let's talk COVID-19 and mental health, because we've seen the stories, we've read them, they're on every major news network. How has mental health, globally or otherwise, been affected by the pandemic?
So mental health has been affected largely. A part of this theme coming about this year was due to the fact that they were finding increased cases of mental health. So mental health became a pandemic within itself, in that mental health cases were increasing across the world. And this is something we face when persons have to change, when they have to move from their normal. Because let's be honest, COVID came in and it just hit us by surprise, and it changed many people's lives. So for persons, they would have lost their jobs, or they would have had to social distance, they would have had to isolate. And there's a certain level of fear that would have come with that, that would have, one, cause mental illness, and two, for persons that were suffering from mental illnesses, it would have made that worse. And it's a fact that, okay, I'm suffering from a mental illness and I have to stay inside. And mental health is a holistic thing where it's not just taking medication. So you have to think about, one, taking your medication, interacting with others, getting your checkup. And that made it extremely difficult, in that I could no longer just go to the doctor because I wasn't feeling well. When it comes to mental health, it can be a little touch and go. It can be a little difficult to manage. And persons like to know that they are able to reach out to their doctor should something go wrong. So that is one of the things that persons struggled with, in that I no longer had the freedom to do what I needed. The socialization, family support is so important when it comes to mental health. Having that level of support is something that helps to keep people well, and not being able to say, go to this person's house or travel to see this person, it really caused mental illnesses to be a bit more stressful to deal with, a bit more difficult to deal with.
How have people within your area, your profession, adapted as a result of COVID in terms of addressing mental health issues? And I ask this because I know of others who have made adjustments, trying to utilize technology and so forth. So I just wanted to know, on a wider basis, how have people within your profession coped or adapted to suit your services amidst COVID?
So we try to make the service more accessible, but we did have to take into consideration that COVID-19 was here. So we too did have to cut back. We did have to make appointments a little further apart. But in addition to that, we, Roselle and myself, we were on the COVID task force. So we were there to provide psychosocial support for persons who came in who were on quarantine, isolation, and positive persons. And that was offered via the telephone. So that really did play a major role in providing services within this pandemic, in that we were able to call and communicate with people within their own home, talk to them and see how much we could assist, how much information we could provide. Because anxiety was there. Many people just became anxious. So via the phone, we were able to provide methods of coping with your anxiety from within the home. So I would say we adjusted with the means that we had to adjust.
What was the response like from those who you reached out to via phone, for instance? This would have been a new approach for you and possibly a very first for them as well. So what was the response to the service being offered over phone as opposed to in person?
Well, generally, it was well.
I think it was
well received. It was
taken.
well received. Obviously, there were persons who had their own particular needs that they needed to be addressed, and therefore, the response would have not been, pleasant in the beginning, but generally it was well received, because we saw that despite the need to address the other things, the protocols, and to address the medical aspect of it, from what we were seeing, obviously, as Ms. Matthews said, there were issues. People were anxious, fearful, doubtful, and it's still raining now. So the psychosocial team was there to not only touch base with persons who were on lockdown, but for healthcare providers, the persons, the nurses, the doctors who were out there going up in your nose, taking those swabs, because they were putting themselves at risk for contracting COVID, and their own mental health was affected. It may not have come to us, but we know of some persons who were concerned about their own health, concerned about their family's health, concerned about their future. So it was good to know that persons generally accepted it. And that's the thing. What we're doing here is just pitching again for persons to understand what counseling is, what social intervention is, what crisis intervention is, and the importance of psychosocial support. Because for too long we have been, people like Commerce want to talk people's business, but it's not about your business. It's about, because of the training, we're able to identify certain things and work with you for a purposeful change. So that's what happened on the phone. You talk to somebody nicely, you let them speak, because that's the only thing they can do at the moment, is to let you know, I am upset, I am fearful, I want to go to my house, I want to leave,
I want to speak to my children
I want to see
interact.
my children. So you have to really understand, because I couldn't imagine myself being in quarantine or in isolation. So it's about understanding what someone is going through, being very empathetic, and that's what we do on a daily basis. Sometimes we do get overwhelmed.
We do.
We are burnt out at times, but when you love what you do, and when you are focused on giving the best service to the best of your ability, some things really come easily. And because we work with a team, that you're able to function optimally. When you know that you can count on your team, it's even better. When you're able to make sure that your team is doing okay, because you have to check in on your own mental health as well. There are days where you're like, I'm not doing this today. Because when you take on a lot of other persons, their own issues, it does affect you, because you're a human as well, and you have your own traumatic experiences. So there were persons on the team whose family members had COVID, or family member had COVID. So, we have to be mindful that we are human, and we need rest, we need support. No matter what your position is, it could be counselor, teacher, educator, you could be the police commissioner. We all need support, and our mental health is key.
And what are some lessons for you within your profession coming out of COVID? Not that we're out of COVID, certainly not over, and no time soon it appears. But so far, what are some of the lessons that COVID has taught you in terms of your profession and what you do, your professional space, how you conduct your work?
What COVID has taught me is that I'm creative. It has taught me that I have the strength, because there are times when you thought when I thought I couldn't do something, and you realize that you can push yourself a little bit more. It has really highlighted my strengths, had me work on my weaknesses. I think it has brought our team closer together, because we had to make sure we checked in. So this person had this case, how is he or she doing? Do we need to do this? What do we need to do? If this document doesn't look well, we'll work on it together. So it has really highlighted that, and take it outside of myself, that as a country, I think we do have the resources. I do think that we can work together. I do think that we can really make an impact when it comes to mental health and mental health services, because we know there are different programs, different departments that said, yes, this is a good idea, we need to put this in. So people are coming. They're coming forward
One by one.
The persons who were on quarantine, they were able to say thank you, one or two persons, because they were able to see the benefit to them. If one person benefits, then they tell another person, and another person. It's about the trickle-down effect, and that's what we're working on.
And that's how we decrease the stigma. One thing it has also taught me is how resilient I can be. We worked very long hours in COVID, so it really taught we can adjust. For the things that we think we cannot do, once put in that situation and we have the motivation and we have the right environment, we can adjust. And this is why I always speak to social support, because as Ms. Solomon stated, we made it through because of our own team and checking in and making sure that persons were well. And on days when persons just could not be their optimal self, somebody stepped up to the plate and said, okay, I see you, let me tag in right now and see how I can be of assistance. So that's the thing that we want to continue to touch on, support and being resilient. Yes, the pandemic has hit us with something that we've never done before, but as a people, we can adjust to what is happening. We just have to stop and take the time and say, okay, I'm not going to be able to do this in this manner anymore, but let me brainstorm. How can I do it differently? How can I adjust? And that is how we get through, by not worrying about the things that we cannot control, but stopping to pinpoint what do I need to make better and what do I need to do to get that done.
I want to take this opportunity to definitely commend both of you as well as your team for the work that you've done so far during this whole COVID pandemic here in St. Vincent and the Grenadines. And you can take this opportunity as well to say hello to your team members. You can look at the cameras and say hello to them for the work that they've been doing as well.
And I must plug that if it wasn't for our authority figures who really rallied behind us in understanding the need for it, and able to welcome us with open arms and have us work directly and intertwine with the team, then this would not have been a reality. And it's just for other sectors to understand what psychosocial support is and how you, in your little way, can create such a program within your own department. I know that there are some persons who want to do EAP, Employee Assistance Program. So you can do little things within your little corner to help.
You're watching Roundtable Talk. So much more. Don't go anywhere. VC3, channel 114.
On Friday, October 2nd, there'll be thousands of dollars to be won. A lotto jackpot of $111,000. A new home, car, or that college education.
Lotto, you have to be in it to win it.
Next lotto jackpot, $111,000.
This evening on the VC3 News Updates, Prime Minister Dr. the Honorable Ralph Gonsalves highlights that the decline of the GDP of St. Vincent and the Grenadines was the lowest in the currency union. Local farmers assured that efforts are being made to address the issue of predial larceny by the Ministry of Agriculture, Industry and Labour. And the Book of Vincentian Patriotic and School Songs expected to play an important role in bridging the generational gap, according to the National Cultural Foundation.
And in sports, last weekend hosted 4 matches as the Hyrule Northeast Football League Village competition went full throttle at the Chili playing field. Also, Year 2 Arts, Sciences and General Studies thumped Year 2 Technical and Vocational 6-0 in the Interfaculty Football competition. Also, Volcanoes and newcomers Cali Ballers played to a 1-all draw yesterday at the Stubbs playing field. Regionally, Cricket West Indies and New Zealand Cricket yesterday announced the proposed schedule for the bilateral series to play 3 T20 internationals and 2 tests from November 27th to December 15th.
Join us at 7 p.m. for these stories and more on the VC3 News Updates.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
This Friday, October 11th, the Super 6 jackpot is $200,000. Super 6, more jackpot money.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
Welcome back to Roundtable Talk. I am here with Ms. Matthews and Ms. Solomon. If you've been following, we are talking about mental health. Mental Health Awareness Day is coming up, ladies and gentlemen, in just about 11 or so days. October 10th. I hope my math is correct.
You're correct.
Correct.
You know how I am.
Yes.
So the day is coming up. This is a day that is celebrated globally. It's global recognition all over the world. October 10th is designated as Mental Health Awareness Day. So we're going to talk about what's happening here locally to commemorate such an important date in relation to mental health.
Okay, so thinking on the theme, mental health for all, greater investment, greater access. We thought about mental health and what can we do to really get mental health out there, because what has been happening with COVID-19 has been increasing the number of mental health issues that we've currently been experiencing. So we tried to see how we can get the public involved while still being mindful that we have to think about COVID and social distance. And even though we don't have cases, we still need to be mindful of what is happening. So we decided to have 10 days of activities so that we could spread these activities out. And what we did, we separated them. So we wanted to do activities that were geared at the inpatients at the Mental Health Rehabilitation Center. We wanted to have activities for the general public, and then we wanted to have informative activities. So what we're doing here on VC3, that counts as us giving information. So to go through the 10 days of activities, so
Let's start day one.
let's start there. So day one being tomorrow.
Well, today actually.
Today.
Today.
So today,
I'm not the one with the math problem.
No.
So today we did VC3 TV, where we talked mental health, our theme for this year. Tomorrow we're back at VC3, which is an activity that we're very excited for, Acoustic. So
how is that going to work? Because I think we know acoustic to be music and vibes right on this stage.
Yes,
So how is that going to work in terms of mental health?
Okay. Well, so the idea, as Ms. Matthews said, is mental health for all. And we're not looking at just inpatients. We are looking at the wider society. We're looking at vulnerable populations, be it the elderly, be it persons with disabilities, children, women, all Vincentians. And we thought it best to showcase that despite having a mental illness, that I am human. I can do things. I have talent. And who we are showcasing tomorrow evening, they have talent.
Nice.
it's going to be amazing. So make sure to tune in tomorrow at 8 o'clock on VC3 to see what this talent is, because I can guarantee you it's going to be amazing.
Well, we know they don't have to switch on because their TVs are always locked on to VC3. So that's day 1 or that's day 2. See, this is why.
That's quite fine.
Yeah, so it comes up to more than 10 days of activities. So I'm just going to go through.
Correct.
So we have NBC Radio tomorrow, 7:05 at 10:15, where we're going to be talking a little bit more about mental health and mental health awareness. We're doing an activity for inpatient cricket with friends. So we have our former occupational therapist coming in to do physical activity with patients, because a part of mental health is making sure that persons engage in physical activity, as that helps to improve a person's mental health. We have a cleanup day at mental health, so we will be cleaning up our surroundings. We're also being mindful of what's happening with dengue, so we're making sure that we sort that out. So we're doing a cleanup, we're planting trees as well. We want to make it a better environment. We are not going to be at mental health forever. So we want to leave a mark, and we want to make sure that mental health is better for it. So we're going to be planting a lot of fruit trees that were donated by Dunbarton and the Orange Hill Plant Nursery to us. We have a lot of fruits, mangoes, poplars, guavas. It's a wide variety of fruits. We're doing church service. We're a very Christian society, so we believe in everything that we do, it has to be inclusive. So that is something that we do at mental health for the patients. We have a lot of them that love to sing hymns, So we do that church service at the mental health institution.
On Sunday.
There are more radio slots that we're going to cover, which is inclusive of Extreme. We are having a movie night in the institution. And so we spoke about having activities geared at the public. So what we will be doing for the 10th Mental Health Awareness Day is we will be having a Zoom session where we are going to be talking on the theme Mental Health for All, Greater Investment, Greater Access. Now we're having 2 separate Zoom sessions. So one will be on the 8th and one will be on the 10th. The one on the 8th will be for adults. It will be at 6 o'clock. We're encouraging persons, if you want to participate, you can call the Mental Health Rehabilitation Center at 458-4240 or 458-6185. You can call us and let us know you want to participate. We will send you that email. We are going to have panelists where we're going to speak on the topic, and we're just going to speak on issues that have been affecting persons, and we're inviting persons to come in and participate. So that is for the adults, and we want it to be inclusive of the children as well, because it has been a change for them in this year, not going to school, having to do things via Zoom, having to not be able to go over to your friends' house. So we wanted to come in and have a chat with them. How are you feeling? How have you been coping? Ms. Solomon will be moderating a very interactive session. We do have some young ones that are going to come in and speak with us. So parents as well, they can call and let us know they want to participate. It's via Zoom. So we have that platform where you come in, you can talk, you can participate, you can share on the topics that we are discussing. So we have one for children and one for adults. Nice. One is on the 8th for the adults at 6 o'clock and on the 10th at 2 o'clock for children. So they can call mental health. If you see any mental health person, myself, Ms. Solomon, you can let us know you want to participate in this activity, and we will make sure that that email is sent out to them.
So speaking of contact, I know we're getting ready to wrap up. I mean, you guys have an amazing packed 10 days. So I really hope you're taking care of your own mental health, because it seems as if from today, space.
Yes.
Going into the 10th.
We didn't have carnival this year, so we put all that energy into this. Yes.
So we're talking mental health, and we're getting ready to wrap up. Just to remind you, Mental Health Awareness Day is going to be celebrated globally on October 10th. And just to remind you how to get in touch should you need mental health support or you know of someone who may be in need of that support, the ladies are going to remind you and give their contact details. But I just also want to take this opportunity to let people know, as they've been saying throughout this session, to please step forward. If you are feeling some type of way, as you know, the music would say you're feeling some type of way, reach out. We have the support systems in place to assist you. And the ladies are going to tell you exactly how you can reach out.
All right, so as we identified before, our telephone numbers are 4586-185, 4584-240, and our email address mhcsvg@gmail.com. So mhcsvg@gmail.com.
Now, as we get ready to wrap up, would you ladies like to say any last words? Or maybe I should rephrase that.
Yes.
Yeah, because you know,
Sounds a bit
last
morbid.
words is a
Yes, a bit
bit
morbid,
grim.
yes.
Okay.
So would you guys like to leave a message with our audience as we get ready to wrap up this roundtable talk session today?
I just wanted to encourage persons, your mental health is important. There is no health without good mental health. Should you feel that you need the assistance, do not wait until it gets to a terrible situation. Do not wait till it gets too serious. Reach out and get the necessary help that you need. We are here. That is why we are here. We love what we do. This is our field. Nothing can be too terrible that you feel like, okay, I can never reach out for this help. So reach out and get the necessary help that you need.
You heard it from Miss Matthews, and guess what? As we say, we're keeping it locked to VC3 channel 114. Of course, you can also view on YouTube live as well as Facebook. And to commemorate Mental Health Awareness tomorrow night, Acoustic is taking on Mental Health for All with a special presentation powered by the ladies and the rest of the mental health awareness team. We want to thank you so much for tuning into VC3, whether you're watching on TV, on Facebook, or YouTube. As we get ready to end this session, Acoustic tomorrow night on VC3, Mental Health for All. Just a reminder, Mental Health Awareness Day, globally commemorated on October 10th. And this year's theme is
Mental health for all, greater investment, greater access.
You heard it right here on VC3. This is Roundtable Talk. I am Tedra Kirby. Thank you so much, Miss Ellica Matthews, for coming in, as well as Miss Roselle Solomon. You've heard how to get in touch with them. And just to remind you, Miss Matthews is a counselor at the Mental Health Rehabilitation Center, as well as Ms. Solomon is a social worker within the Ministry of Health, Wellness, and the Environment. Ladies, thank you so much.
Thank you for having us.
Thank you, BC3.